Okay, so I got a lot of questions about studying and studying tips from Master Dova 232, Matt Smith, Hannah W, Simon Torres, Jill Ammerman. Studying tips for lectures, pathophysiology, pharmacology, how to retain all this info. So my biggest advice would be to go get an NCLEX study book. So this would be the book that you study in preparation for the NCLEX, because those books a lot of the time have little review the material of every body system, of like the different specialties of nursing, the stuff that you'll get tested on in the NCLEX, and the stuff that you're tested on while you're in nursing school. So that's great material to review. And then the NCLEX questions related to that material help you prepare for your nursing school tests, because those tests in nursing school are going to simulate NCLEX style questions where there's like a scenario and you just have to figure out like what's the best response. Even though multiple responses might be good answers, one of them's the best. Oh, nursing school exams suck. When it comes to, say, pharmacology and pathophysiology, I got specific questions about those. Pharmacology. And it all depends on the course and the professor that teaches it. These are two classes where it is kind of a lot of retaining information and spitting it back out, a lot of memorization. For pharmacology, I would study the name endings of drugs. So if you know it ends in LOL, you know it's a beta blocker. If it ends in PRIL, it's a ACE inhibitor. So you have those drugs that make that easy to recognize it. Then, so know the drug name, then I would note its action, and then the disorders that it treats. And then some side effects that are unique to that drug. Every drug's going to have nausea and vomiting as a side effect, most likely, as a possible side effect. So if there's one that's unique to that drug that sticks out, then I would memorize that. So the name of the drug, its action, the disorder it treats, and unique side effects. So that was pharmacology for me. That's how it worked. I used flashcards, and that worked for me. For pathophysiology, I did it fairly similar. I used flashcards. I would study the name of a disorder, what caused the disorder, and then how the disorder was treated. And I would just use flashcards to, I don't know, teach myself that stuff. And all of these questions are going to be put into an NCLEX style question a lot of the time. So it'll be a situation where the nurse walks in and she sees that the patient's heart rate is this and the blood pressure is this. What would you assume the doctor would give to the patient? What type of medicine or something? And you're going to be like, oh, beta blocker, because I remember that. Again, it depends on the quality of the teacher. I'm going to say that. I mean, some professors make stuff really confusing, and that sucks. And then there's some that make it very easy to understand, and that's a good teacher. And the quality of your textbook, because a lot of the time your professor might just say, go review this from the textbook, and if it's super hard to read, then that's not cool. So the professor and the textbook help, determine the quality of the class. So Nick Asarbata, is that how you pronounce your last name, Nick? Asarbata? Nick Asarbata? Asarbata? A fellow nurse. He asked what I did before nursing and why I wanted to become a nurse. So that's a long story, and I'm actually going to make an About Me video where I talk about the stuff I did before nursing and what led up to nursing and why I became a nurse, and then where I think I'm going with my nursing and my future and all that. So I'm going to put all that in its own video, because I could talk about myself for a long time, I guess. But Nick also asked, what do I say to those who say you need some med-surg floor experience before you move on to an ICU, ER specialty type unit? And I would say med-surg floors give you great experience. You see a lot of disorders. You can have a lot of lower stress learning scenarios compared to an ICU. But, I mean, I went straight into an ICU. I know a lot of other people who went straight into an ICU, into an ER. Depends on whether your hospital's hiring new grads for those positions. But it's doable, as long as they have a great preceptor program. If you're a person who doesn't want to go jumping into some chaos at times, then I would say go to a med-surg floor. You're still going to have a lot of craziness that goes on, but the acuity level is obviously higher in the ICUs, in your bigger ERs. But I mean, there were times when I got into an ICU and I thought, man, I wish I had some less acute patients where I could go a little slower, and, well, not necessarily slower because the floors are busy, but you didn't have to like freak out. Your heart didn't start racing so much because your patients kept trying to die on you. But if you're okay getting into those situations and learning quickly with your preceptor, and being willing to jump in on code situations that are going to be happening, then there's nothing wrong with going straight into an ICU or an ER. So yeah. And then U of L fan and NR, they were asking about how likely it is for a new grad to get into an ICU, and it all depends on the hospital. I got right into an ICU, and it wasn't a big issue. They were hiring new grads, so yeah. I will say that an interview is important. You got to show yourself as being confident, willing to jump into a challenge. Just be a good people person. Don't look super scared, super shy, or the ICU probably won't hire you. You just got to be willing to get in there and learn. You don't have to know everything, obviously, but to get into an ICU position, the interview, I think, is very important. Savannah McDowell asked, how hard is it to get a job after graduation, and is it important to make connections, like basically during your clinicals, and does that help? And I would say, at least in my experience, it's not hard to find a job right now. Me and all my classmates found jobs fairly quickly. We're all nurses. Making connections in hospitals during clinicals is very helpful because they will remember you, especially during your final practicum. If you end up wanting to go back to work at that hospital, if you did great during your final practicum and people liked you, then definitely they'll remember you, and that can help. So meet people, meet the supervisor, meet other nurses, get your name out there. That fish breeder asks, what do I think about ER trauma nursing? And I would say that I think it's cool and it's exciting. I did my final nursing school practicum in the ER of a level 1 trauma hospital, so we were getting the helicopters that came in, a lot of the crazy traumas, and if you're interested in being in an environment where you never know what's going to be coming in, if you are interested in being in an environment where you don't know what's going to be coming in, it could be everything from a sore throat to a gunshot victim to a motor vehicle accident to someone having a heart attack or a stroke. If you're interested in that excitement and jumping in on whatever's coming in the door, then ER trauma nursing's for you. Yeah, you'll get a lot of psychiatric patients that come into ERs as well, which is very interesting. So if you want to see a little bit of everything, then ER trauma nursing, that can be pretty exciting. You just kind of like in an ICU, you got to be willing to jump in the deep end. There's going to be code situations. There are going to be very bloody situations. There's going to be people shouting at you from across the ER, and a lot of security presence and police presence in ERs. So if you're into that, then that is ER trauma nursing.